Another thing that I've been finding lately, I'm not sure how, what your area is like, but like I said before, I'm in Connecticut. So when I do a physical exam, a lot of times I add in the Lyme disease screening with the Western blot if it comes back positive, like they automatically do it. Now, a lot of people don't do this, and I think it's pretty important, especially since, I'm in Connecticut where Lyme disease was named because that was found. Really weird. Not weird because of where we're at, but I feel like it should be like kind of a standard thing that when you live somewhere where there's a lot of deer tick. So I'm not sure if you know, but those are the kind of ticks that cause Lyme. There are other kinds of ticks that are big and fat that don't. So become familiar with that if you're in an area. Even if you're not, people travel. You get people that come in and they've had aches, pains, body aches, joint pain, like all these things for a while, and they a lot of times have they can have like migraines or paresthesias, like all these things that could be something else. And a lot of times they they have comorbidities or they're heavy or whatever. And you think, oh, it's probably, osteoarthritis or, some kind of like rheumatoid. However, which is the same thing that I think a lot of times too. And if they have the issues of like joint aches and pains and the arthralgias or whatever, I test for Lyme. Normally like on my initial like visit, and then if that comes back a negative, because it's a little bit cheaper, then I'll look in for like the CRP, the ANA, things like that to check for and like uric acid to check for anything like that would be like inflammatory or autoimmune. So just want to kind of push the whole, like, if people are having the body aches, pains, anything that you possibly think could be Lyme disease, just test for it. If you're already running labs, most of the times you can get it paid for through insurance companies. It's too dumb of a diagnosis not to catch. I don't mean it's a dumb diagnosis, but it's too easy to find and then to treat. So you don't want to be the person that misses the Lyme, and these poor people are in severe pain, which I've had patients that have had it for a while, and then like turns out like they've got crazy reaction and positives on their Western blot. So kind of another thing to look out for. Also, another thing to look out for with all, the daytime fatigue, kind of like the whole like achiness, that kind of thing. I found lupus a couple of times, so if you're not familiar with lupus, you may want to be. I can talk about that a little bit more later, but just another thing to keep on your radar if you are testing for anything anti-inflammatory, like your rheumatoids or your arthritises or, anything like that. Lupus is kind of, you just throw that in there. I always throw in a uric acid to make sure that's okay. And, because it's joints, make sure there's no gout going on. So, because there are like, non-classic gout presentations as well. So those have been a couple of things that I've kind of had to look to recently. And like I said, I have found a couple of like rheumatoids. There's some cases where they have all of these things, and it turns out that I have to send them to a rheumatoid arthritis, not a rheumatoid arthritis, but rheumatoid, because I can't figure it out, and I'm thinking it's probably fibromyalgia, but I need kind of a definitive. Another thing that I've been finding a lot is if you have someone that is a female in their 50s, definitely, I think it's 55. It might be 60, but I think 55 you can do it. The DEXA bone scans, because lately I've been finding a lot of osteopenia, osteoporosis. I've even found Paget's disease as well, due to like just weird, backaches that were sending like radiating pain to the legs, but it was like crazy, like 10 out of 10 tingly pain. I don't know, just really weird things, but these are diagnoses that we don't really like hear about a lot, like the Paget's, or we don't think to do the DEXA bone scan or things like that on our older folks when we probably should. Another thing.
It's 11 o'clock.
It's 11. Dang it, now I lost my check here. Oh, vitamin D and labs. So a lot of people don't add in their physical labs vitamin D level. Everybody is like, I would say 95% of people that I test have low vitamin D. They can have all kinds of manifestations from that. Also B12. That's something that I add into my regular labs that I draw. Also, iron and ferritin. I always draw those too. They're not added on any like panel. Some people will be like, I don't even bother with the iron anymore. I just go straight for the ferritin. But I kind of have a problem with that because if you have anemia of chronic disease, having the iron and the ferritin will actually help you make that diagnosis faster. Because of course you have your CBC, but on top of it you'll have your iron and your ferritin, and that way you have the complete picture of what's going on. So I think it's kind of important to kind of add that on there. You don't have to. That's just kind of something that I do, and I've found a lot. If you find like a really super high ferritin level and a low iron, if you look at your charts of anemias, and you don't know if someone has a chronic disease, it might trigger you to actually look and find something. So there has been a case or two where it was like, wow, they have super high, ferritin and low iron, and like what's going on. And then it turns out that they have some kind of like renal or like kidney disease, tumor, something like that. So you'll want to look for something that's chronic, that would be causing the body to store the ferritin. So, and then what if you would have a low iron? So just little kind of tricks, labs or whatever to draw, things that I have found useful. And I hope it helps you. I'll talk to you soon. Good luck.